The Hoover test is used to identify a malingering patient. The patient attempts an active straight leg raise on the involved side. If the clinician doesn't feel any pressure in the uninvolved limb, the test is positive. Adam's test is for scoliosis. The patient bends forward and the clinician observes their back. If there's an asymmetrical hump along the lateral aspect of the spine and rib cage, the test is positive. Beaver's sign tests for thoracic nerve inhibition. While lying down, the patient performs a crunch. If the umbilicus moves up, down, or to one side, the test is positive. Valsalva's test attempts to increase intrathecal pressure. This will duplicate nerve root pain. While the patient holds their breath, if they have any pain on their spine, that is a positive test. Milgram test is used to increase pressure on the lumbar nerve roots. The patient performs a bilateral straight leg raise to the height of 2 to 6 inches. If the patient cannot hold the position, it cannot lift the leg, or experiences any pain, that is a positive sign.
Straight leg raise tests for sciatic nerve irritation and compression. Pain described before the hip reaches 70 degrees of hip flexion may indicate a disc involvement. The positive test is a patient complaining of pain before the end of the normal range of motion, which is 70 degrees.
Straight leg raising test is used to identify a large space occupying lesion. The unaffected leg is lifted as high as it can go. If pain is experienced on the opposite side that's being raised, it is a positive test.
The slump test is looking for impingement of the dural lining, spinal cord, or nerve roots. A positive test would be sciatic pain or reproduction of other neurological symptoms. The quadrant test is looking for radicular pain that indicates compression of the intervertebral foramina that impinges on the lumbar and nerve roots. Local pain indicates facet joint pathology. Symptoms isolated to the area of the PSIS may also indicate SI joint dysfunction. A positive test would be reproduction of the patient's symptoms. Lower extremity dermatomes: L1, L2, L3, L4, L5, S1, S2. Lower extremity myotomes: L1, L2, L3, L4, L5, S1, S2. Stand up on your tiptoes. The femoral nerve stretch test is looking for a nerve root impingement at the L2, L3, or L4 level. A positive test would be pain that is elicited in the anterior and lateral thigh. The tension sign test is looking for a sciatic nerve irritation. A positive test would be exquisite tenderness with possible duplication of sciatic symptoms as compared with the opposite side. The single leg stance test places shear force on the pars interarticularis by the iliopsoas, pulling the vertebra anteriorly, resulting in pain. A positive test would be pain noted in the lumbar spine or SI area. The sacroiliac joint compression and distraction tests are looking for sacroiliac pathology. A positive test would be pain arising from the SI joint. The Faber test is looking for pain in the inguinal area anterior to the hip that may indicate a hip pathology. Pain in the SI area during the application of overpressure may indicate SI joint pathology. A positive test would be reproduction of symptoms in the sacroiliac joint or hip. Gainsland's test tests for SI joint dysfunction. A positive test would be pain in the SI region. The long sit test is testing for a rotated ilium. A positive test would be movement of the medial malleoli. If the involved leg goes from longer to shorter position, there is an anterior rotation of the ilium on that side. If the involved side goes from a shorter to a longer position, posterior rotation of the ilium of the sacrum is indicated.